Hello, I'm Mike Ryan and welcome to Asia Pacific Today. Is the time coming for some truth-telling by government authorities and our public health experts? When will authorities right the wrongs of measuring the prevalence of the virus and the overstatement of cases and deaths? Why is early treatment of the disease so shrouded in controversy and censorship? And with vaccines now being distributed, why are governments still hell-bent on ineffective lockdowns, even in localities where few cases exist? Previously, the American Medical Association had issued a statement in March 2020 that was highly critical of hydroxychloroquine, or HCQ, in regards to its use as a proposed treatment by some physicians in the early stages of COVID-19. In addition to discouraging doctors from ordering the medication in bulk for off-label use, HCQ typically is used to treat diseases such as malaria. They also claimed that there was no proof that it was effective in treating COVID and that its use could be harmful in some instances. However, on page 18 of a recent AMA memo issued on October 30, Resolution 509, page 3, that the American Medical Association officially reversed their stance on HCQ, stating that its potential for good currently may supersede the threat of any potential harmful side effects. Earlier this week, an Australian politician, Craig Kelly, was attacked, laughed at, and basically dismissed as a crackpot for suggesting that Australia should also look at hydroxychloroquine and ivermectin.
I'm actually telling them that the PM students stop you spreading these crazy conspiracy theories.
Did you hear about Professor Clancy? You've got to listen to our most senior immunologist, Tanya. It's Professor Robert Clancy. Listen to him. Go and get his stuff. Read what he's saying, and you'll find out, and then you can come and apologise to us. Okay?
My mum lives in your electorate, and I don't want her exposed to people who are not going to be vaccinated because of these crazy conspiracy theories that you're spreading.
You're the one doing that because you are the one spreading misinformation. Right? You've got to listen to the professors.
After more than 12 months, there's still serious questions on China's part in the spread of the virus and its poor management from the earliest stages. Why aren't government authorities accountable? The COVID-19 pandemic is being increasingly seen as an ugly game of politics, played by leaders and public health officials around the world. Considering their self-interest over the well-being of their people, governments globally have used the pandemic to gain political advantage and power. Vital information has been restricted or manipulated to keep populations fearful and grateful. Mainstream media, big tech and social media have been encouraged to spread misinformation and hysteria. Shut you down. Millions have died, in the main the most vulnerable, while millions more have faced enormous suffering from indiscriminately imposed restrictions on their liberty and right to earn a living. I'm dismayed at the hysteria for the media, which creates absolute panic and fear in the community. Great for clickbait, pretty poor for credibility. The media simply is the PR firm for government, big tech and the oligarchs such as George Soros, Mark Zuckerberg, Jack Dorsey, Bill Gates, who want you to do as you are told. It's for the greater good, or at least their greater good. And I understand that politicians have their agenda. What they don't understand is that it's not their agenda they should focus on, it's our agenda they should focus on. And tell the truth. I'm Mike Ryan.